good morning, good night, I don't know. Today we're gonna have another podcast, and we have our dear guest, Dr. Vlad Ferdkoff. Thank you. Nice to see you with us with Chairside Stories.
Pleasure. Thank you for having me.
Yeah, and as usual, the first question: how come you became a dentist? What happened? You became a dentist.
Well, I'm from a medical family. Everybody in my family were in the medical field. My parents are physicians, aunts, uncles, but the person who actually directed me towards the dentistry is my uncle.
Mm-hmm.
So we have a 6-year difference, so he was more like an older brother to me. Once he decided to be a dentist, I decided to be a dentist. So I probably was 8 years old.
But you became dentist right away, but because I know you were kind of, as me, a dental technician in the beginning.
Yeah, I started my pathway as a dental technician. I graduated from the dental technician school. Worked for briefly as a dental technician, but yeah, I did work in the lab. But the goal was always with dental school. The goal was to become a dentist. Dental technician was like a stepstone.
When you came here, you went to dental school right away, or you were in the bachelor degree first, right?
I did some undergraduate studies at Loyola University, about 2 years. I did it part-time. I also worked during that time. And then I was admitted to Northwestern University.
It's a dental school.
Yeah.
How was it? Hard? Easy?
Well, the first 2 years were probably the hardest years of my life, and the last 2 years was the easiest years of my life.
What's the difference?
Once we started, clinical rotations and working with patients and in the lab, that was easy. But the first 2 years were pretty difficult.
It was theory. It's what you have to learn.
Right.
Everything,
but once we started doing the, setting teeth for dentures and all that other stuff.
But like in dental school, probably half everybody else, because you knew what to do as your background, right?
Yeah, I was pretty much I started at 9 o'clock. I was done with my assignment by 10. That's why the third and the fourth year were the easiest. It was fun.
Wow. How hard for you was in the beginning to get new patients, like first patients? And who was your first patient, if you remember? Because usually it's like relatives to try on, right?
My first ever patient in dental school was a very sweet black lady, and her first name was Odessa.
Oh my God! Oh, I still remember. Wow.
Listen.
It's hard to forget. Yeah.
It's hard to forget.
Yeah.
But I was doing a cleaning, and she took a nap. She woke up, in 3 hours. That's how much time it took me to do the cleaning. But that was my first patient. I still remember.
Wow. Do you remember any, like, maybe because in the beginning it's hard to perform everything. Sometimes it's so many funny moments in the practice. Do you remember anything like funny? Hard, I know it's hard, but sometimes patients so funny and come out funny results too.
You know what was my first funny moment? After graduation, I worked as a clinical instructor at Northwestern Dental School. My first day on the job as a clinical instructor, and I felt very important. So one of the students asked me to check the gold onlay, which probably took him like 2 weeks to make. It was one of the hardest assignments. And I was checking the contacts with the floss, and patient swallowed onlay.
It's gold, yeah.
That was my first job. First day on the job.
What was your suggestion at the time? You were thinking what we're gonna do? Did you wait or it?
No.
It's when you have to make a new one.
I helped him to make a new one.
Yeah, gold. I mean, gold. Let's talk about gold. I mean, now everything changed, but digitally, technology unbelievable. But what do you think about gold? About gold crowns, inlays? I don't know. But let's say gold crowns and molars, for example.
One of the best restorations long time. When I started working as a dentist, as an associate, one of my first jobs was in an office where we did a lot of gold onlays and gold crowns. It was difficult, but when it's done right, longevity-wise, there is no better restoration.
Forever, almost forever, if everything good.
Well, nothing is forever.
I know,
You
but
live
for a long time.
You live long enough, you'll replace it. But longevity-wise, it's one of the best restorations. I still have a patient who comes to my office, which I did my first gold onlay on as a private practitioner. Yeah, still there, still functional, still operational. But listen, time changed, and people don't want to have gold in their mouth anymore.
So that was my next question. Nowadays, do you have any patients, or it's kind of already rare?
Actually, I had one patient who we did a special order. We did a gold crown on implant.
Yeah, nowadays gold crowns probably cost like, you know.
Yeah, but he was willing to pay, and this is what he wanted. It was a very, it was a molar, not even a front tooth.
When you finish dental school, did you decide right away open your offices, or you still like work on corporate, or it's like?
When I finished dental school, there was no corporate.
No.
It's kind
a
of
long time ago. Okay.
Yeah. It was private practice. No, but again, I worked at the dental school for about a year and a half, well, maybe 2 years, and I worked as an associate. Got some experience, and then bought my first practice.
Is your first practice still the same place? It's like.
It's the same area.
Same area.
Right. It's in Barrington. It's the same area. The building which my first practice used to be located, it's not there anymore. But we moved into the new building pretty much across the street.
I know your both offices, and I know your personal work. How hard to find somebody right now, and in your office, what you prefer? It's like because I ask everybody, because for me interesting. I'm seeing how to do, not how to do. I know how it's here in my lab, but in your office, it's mostly like a family, or you try to put everybody in the right place, for example. Because it's no middle. It's not in between, because it's gonna be this way or other way, because.
Well, yeah, that line can sometimes be a little gray, but a lot of my people who work with me for many years. So it's like a family. But everybody have to know their responsibility. Everybody, need to know what we expect from them. So it's like in your family, Family is family. You love them, but they need to do what needs to be done.
But do you have some? I know probably you have, but for sure you have time like with these things. So, okay, everybody fired, everybody out. I need everybody new. No, because it's gonna be probably impossible without. Yeah.
Not only that, but no, not everybody.
Not everybody.
There are situations, obviously, when something doesn't go the way you want it to. But to a certain degree, you have to take some responsibility for that as well. If you want to be a leader, you have to, you have to train people, you have to teach them, and they have to know what's expected of them. So we fired a few people, but very few.
Very few. It's good to know. Maybe sometime I'm gonna go for part time as well, because I know you're doing crown in office, right? Yes. Still, you love it.
Yes. The crown office. I actually have a dental technician working for me as well.
I know. Yeah, I know. And is it easy or is it hard for you to not make crowns, to make something in the office? Because I know some dentists said, I don't want to even touch it. It's not my job. I know it's dental tech. They have to do. But I know you like it, right?
Yes, plus the technology allows us to do it much easier now. I first was exposed to CEREC back in dental school.
Oh.
It probably, we had one of the first CERECs probably at Northwestern. I don't know, it probably was 1D, not even 2D.
2D, yeah.
So but I was able to see over the years how the technology improves, and nowadays the AI incorporated design.
Yep.
Materials are very easy to polish, to work with. Good aesthetics, very precise. I like it. Plus, it's a convenience for the patients.
1 hour crown.
Yes, and
Pretty
there is
much.
no second appointment. You do not need to be numbed twice. You do not need to worry about temporary coming off, and which happens quite often. And sometimes I remember good old times when people would come in, between the crowns would come in 2-3 times with a broken temporary or temporary came off. I mean, it's a good service for the patient. It's convenience, but it's also a good service.
What we're talking about, probably posterities, anteriorities, you still have to kind of.
It's doable.
Uh-oh.
You need, we do anteriorities as well. I just did one today, but it requires more training, more skills. But it's doable.
Really?
We're getting very good results. Now, granted, if we're doing the big cosmetic case, then we do it on the lab.
Yeah, no, but I'm saying it's nowadays technology like that you can do even, like, let's say, front teeth.
Actually, to do single anterior crown, it's easier for me to do it on the lab. My technician can do the custom shading right there. We can do the adjustments. It's much easier for us to make it look natural, to match it to other teeth, because that's the most difficult restoration aesthetically. To match one front crown.
But it means you can put even a stain in the lab too.
Yeah.
That's it. That's
We
just
can
glaze
stain,
and
we
stain.
can stain and glaze it. Yeah, we do custom shading.
And it's in the same day patient gonna go home with the crown.
Exactly.
Wow, nice. Everybody going to Dr. Ferdkoff. But no more labs done. No, I know.
We still need labs.
Oh yeah.
That's why I'm here.
Yeah, I know. But with AI, how easy right now, even for us too, because instead of even design, like we were sitting designing the crown, but nowadays you just click and the design by itself.
Right, and again, from the first time we were designing in-office crowns, which was pretty tedious work. Now we have to do very few adjustments once the design is already done by AI.
That's it.
And that's where it's going to.
For, let's say, for a new generation of dentists who's just gonna come out from school, it's like totally different achievement, totally different practice, because I mean nowadays everything kind of most digital, but I know for sure they come out from school much less knowledge that you have for sure.
Yes, exactly, and it's listen, the base of everything. If you were taught how to do dentures, and if you set denture teeth by yourself, then you can do any cosmetic case. Then you can do any case involved complicated occlusion. When the AI does everything for you, what happens if the computer broke?
You can buy another computer.
Yeah, that's true. But the base knowledge.
You need.
You don't need the base knowledge.
Yeah, but I mean, I know, like, I just met some new dentists who just came out a couple of years from school, and they kind of struggle because when they came to work, like associate, they just like, I don't know what to do, because they already cheated last 2 years clinicals, everything was computer.
Right. When they go from the digital environment into the old school environment, it's very difficult. But listen, that's why you have to stay with the times. That's why we're constantly upgrading our equipment. So I think digital is the future and the present as well. But what we learned before digital, it gives us advantage.
It's forever probably. Yeah, I know. Yeah, for sure too, because like digital, but when we could do, let's say, front 6 crowns, it's no ways we just have to, let's say, cut back, we put porcelain. I mean, it's no way it's gonna look. We have to.
It's one thing is to see it on the computer screen.
Yeah.
Sometimes it looks completely different in the mouth.
Yeah.
But then, most importantly, in planning as well. I mean, sometimes you can just look at it and you can see right away where it's going to end up.
Yeah. Let's go from dentistry, not to your personal life. What your, your hobby, I know for sure it's dentistry after family, but do you like to travel or you have, do you have, maybe you like to ski or what's your other hobby except teeth?
Yeah, that
It's most of the time, I know.
yeah, it took me a while to to get to the point of my life when I have more free time. We do love to travel.
Yeah.
I don't ski.
Yeah, dangerous, I know.
Yeah, I had when I started my dental career, we tried skiing. I loved it very much, and a lot of my friends who are dentists, they ski a lot. But one of my colleagues who was very established dentist at that point just broke his arm, could not practice for 3 months, and
Wow. You can
and
afford it.
then after that I
Yeah.
said no, skiing is not for me. We used to ride the motorcycles,
Really?
yeah, for quite a while. And
Harleys?
Harleys, yeah.
Wow.
Don't do it anymore.
Why?
Uh,
Dangerous.
No, same thing. It's just
Mhm.
kind of, it's good for a certain stage of your life. We miss it, but that was fun. For many years we did it. We like to travel. I'm trying to get into pickleball.
Yeah, pickleball. We will.
Nowadays.
Yeah, because we did pickleball tournament last summer. It was a durable pickleball tournament. We'll do next summer again,
Okay.
but before we'll try to play.
Maybe I'll enter it in this one.
Yeah, but if you like to travel, do you probably have favorite places to go? When you can go like not only one time, because like for me it's Tuscany. I can go there as much as
There are certain countries
Yeah.
which you do want to go back to. Sometimes you just have to, kind of say, okay, I've been here, done that,
yeah.
mark it on the map. But we like to go back to Italy. Italy is such a big country with such different regions
Mhm.
that every time you go there, it's like a new place. Spain,
Spain.
we can go there at any time.
It's been all this south kind of country, Italy. Yeah, yeah. To me, it's Italy. I don't know. I will wear Spain too, but Italy. I don't know. I can go any region, anytime. No time, but I would love to go. Maybe.
This is one of those areas where you can go back there and it doesn't seem old.
Yeah. We talked like before podcast, like we spoke about the kids when the kids get older. I just want to say because like. Not in my age, but when the kids, let's say small, everything around the kids, and your kids a little older, I just want to ask you, they're already out of the house. How easy and enjoyable this? I just want to, if my kids gonna listen, just make sure I need to know what they're gonna do next.
It's very easy and it's very enjoyable.
Yeah.
So yeah, you're gonna have fun. We spend more time together, a lot of private time. Listen, we got married young, and
Yeah.
we never had any time
Same, yeah.
alone. It's all these kids, grandkids, everything is around us. Now it's two of us, and we go visit our kids, and they come visit us, and we're having fun.
And
We don't
peace at home.
and we don't fight as much.
Yeah. See,
And
everything about
and
kids.
we miss each other now. So that's the difference.
Everything in the future. Yeah.
That's the difference.
Well, talking about food, what is your favorite food? If you like Italy, it's Italian food or it's you love any kind of variety?
I like any kind of
Yeah,
variety.
right.
I like to try things. I like to try new things. I can eat anything. I mean,
Yeah.
we ate. We were in China. We ate.
Oh, you did?
Yeah.
Uh-huh.
We tried.
I know.
We tried everything. I
Everything.
don't even want to mention what we tried.
No.
I like to experiment. There are certain foods I like more than others, but.
Any favorite restaurant? Like, let's say, somewhere around Chicago area. Your favorite restaurants, for example. Like, is the same as Italy. Like, you can go to this restaurant many. It's not a lot.
Well,
many.
we share the favorite restaurant.
Asteria Thrill. Okay. Now I know. Yeah. Giovanni.
Yeah.
Okay.
As far as Italian food, yeah, we love it.
Greek food, for example.
I like Greek food. I like Mediterranean.
Any kind of Mediterranean food.
I like Turkish. We like Turkey. We go there quite often. I've been there many times.
Really?
Yeah,
Oh.
love it.
I know it's new Turkish restaurant open in Lake Forest.
Been there. Very
Good?
nice.
We
Very,
should go.
very
We should
reasonably
go.
priced.
Really?
Very good food, and actually we were there during the lunchtime. It wasn't too busy, so the owner was, waitering, and very nice guy.
Any advice, we're gonna go back to dentist, any advice to our patients, for example, how to save your teeth, what you need to do, what do you have to eat, what you don't have to eat, do you need to use a floss or water pick, what the suggestion to have your teeth great from the beginning. No, because from my experience, I hate dentistry when I was back there, and I don't like it, and I like from my maybe 25 I even never floss, and now it's a result.
Oh, listen, this is the way we grew up.
Yeah.
We did not know a lot of stuff, even though we were, dental technicians.
Yeah.
But when I see how kids are getting introduced to dentistry at a very early age, very careful. When they're getting positive experience at the very early age, most of the time they're not having problems which we have.
Yeah, and scarcity. Yeah,
So, as far as I'm not going to tell anything new. You brush your floss, you use a water pick.
that's it. Yeah.
Yeah.
Any food you have to avoid, let's say.
Listen, it's I'm not in a position to tell people what to eat or not to. What I tell you is that even if you eat lots of sugar, as long as you remove the sugar from your teeth, you'll be fine. So
That's
brush
it.
and floss.
That's it, brush and floss. That's it. It's when we can eat sweet, we can drink whatever we want, and after we just floss it and brush it. I mean, basically, it's good. Okay, good to know.
I would not recommend to drink anything you want, but listen, you have to be within a reason.
In your office, do you play music or it's quiet usually?
We usually have TV on, and
yeah.
we like to have some spa music, and and even on the TV we have some quiet spa type of.
You're a coffee or a tea guy?
I'm a coffee guy who's trying to become a tea guy.
I mean, probably decaf tea.
It's not working too well.
It's not working too well. Any favorites of coffee? Any, let's say, you like Turkish or you like just regular Americano, or because I'm.
Well, it depends. I enjoy cappuccino, but I like the espresso type. But as far as if you want to have a cup of strong coffee, Turkish coffee. My dad makes a mean Turkish coffee.
Really?
Yeah, that's the only one.
Understand.
Yeah. No, not
Just
just.
Good to know. Good to know. Usually, like when you go into the end, I usually ask our guests if you, let's say, if you have any question to me, what would you like to ask me? As it doesn't matter, as a technician or as a friend, whatever.
I just want to mention that I've been working with your lab for many years. This is the first time I actually physically visited your lab, and I'm very impressed.
See? Perfect.
So,
I'm gonna tell this Marcus.
You know what? When I did my first case with Marcus,
Yeah.
Marcus was just Marcus.
Yeah.
There was no lab.
Yeah.
It was
It
just
was
him.
Marcus,
It
yeah.
was just him. Then Valentin came along, and
Yeah.
then you came along, and I'm very impressed with what you did. I mean, this is good.
Yeah.
I mean,
Thank you. Yeah, we're trying to do. I mean, nowadays, it's everybody doing it kind of exactly the same. Market is hard, but still, we're trying to stay quality-wise, not quality because it's most important.
quality and service. is
And so,
important.
yeah, it's
and
just
you
important.
guys pick up the phone when we need you, and you come in when we need you.
And I bring pirogas.
Yes.
Yeah.
Yes, and that's why we call you even if we don't need you.
I know. Irina called me, said, "Leo, are you coming?" No. But you promised you're gonna. I said, "Okay, gonna come. I'll bring."
Okay,
Yeah.
just send the pierogies.
It's
you don't
it.
have to.
Yeah. Okay.
But listen, this is all. It all adds up.
Thank you, Doc. Next time, probably we're gonna do something more, not more in, something different. Maybe we're gonna talk more about something about teaching, something about new. But for now, we're gonna say bye bye and see you guys next time. Thank you, Doctor.
Thank you. Thank you for
Really
inviting me.
appreciate it. Thank you.